Hello, my name is Michelle Zechner. I'm faculty at Rutgers School of Health Professions at the Department of Psychiatric Rehabilitation and Counseling Professions. I've been helping people living with mental health conditions and their families for over 20 years. One of my passions is learning about new services to help people recover from mental health issues. Welcome to Mind Care Matters, a podcast series dedicated to exploring new and innovative strategies to improve mental health. Today, our topic is about peer services, or those people who have lived experience of mental health condition who support other people through mutual support or paid work. I'm so excited to be talking to my colleague from the Academy of Peer Services, Director Dr. Amy Spagno. Dr. Spagno is a faculty member in the Department of Psychiatric Rehabilitation and Counseling Professions at Rutgers University, and she's the project director for the New York State Office of Mental Health funded Academy of Peer Services, the only online training, testing, and tracking platform for the certification of peer support specialists in the world. Welcome, Dr. Spagno.
Oh, thank you so much for having me on the podcast, and please call me Amy. I also thank you for speaking with the Academy of Peer Services team because they are truly the experts on this topic, and I'm just honored to be a part of that team.
Thank you so much, Amy. We've been planning for this for quite some time. I'm so happy to have you here. And as you alluded, this format is a little bit different than our normal podcast because we didn't know how to have 5 people in one podcast. So we're so excited and delighted to have 3 of amazing peer support specialists, and they've contributed some audio clips, and they'll be dropping in remotely by audio clips, so you'll hear from them. So I think we have to start, and first, sort of start out with what is peer support and who is a peer?
Well, good idea to start at the top, Michelle, because in 2007, the Centers for Medicare and Medicaid Services, also known as CMS, recognized peer support services as evidence-based, and thus they became reimbursable under state Medicaid plans. That official guidance, however, does not negate the fact that for many years prior, peer support was provided informally and formally across a multitude of settings in behavioral health. Peer support is as old as time. People have always benefited from engaging, connecting, and supporting one another around shared life experiences, especially difficult or challenging situations. Today, peer support encompasses a range of activities and interactions between people who share similar experiences with mental health conditions, substance use disorders, or both. And I would be remiss if I didn't quote Sherry Mead, who is a pioneer in peer support. Sherry talked about the mutuality of peer support as peerness. And that's the relationship between a peer support worker and a person in or seeking recovery that promotes connection and inspires hope. And really, who wouldn't benefit from that? So I think it's fair to say that peer support workers are people who help other people to develop their own goals, to create strategies for self-empowerment, and to take the concrete steps necessary toward building fulfilling and self-determined lives for themselves. And they do that by sharing the lived experience and offering support around that practical guidance that some folks really need.
Yeah, that's thank you for that. Definition of peer support, because in many ways we're all peers. We all go through things, which that will kind of come up throughout the process today a little bit. We talk about sort of the peer and who are peers. Now, I'd love to ask you, why are peer services important, would you say?
I think peer support is so critically important because of the outcomes that it achieves and how different peer support is from traditional mental health and substance use treatment. Because peer support is really so much about the connection between people that inspires hope, that helps people determine their pathways forward, and really supports people how they want and need to be supported. And I think perhaps more so than ever, peer support workers are being seen as a really necessary segment of the behavioral healthcare workforce, not just as an add-on. And peer support is recognized as a part of the mental health landscape. Peer support specialists work in a variety of settings, from independent peer-run agencies to care management teams to even traditional clinical settings. And they're included, I should say, in a wide range of programs like inpatient or partial hospital programs, clubhouses, recovery and drop-in centers, and in some states, even clinic settings, just to name a few. And I think it's all of our business to uphold and support peer values in any of those settings.
Yeah, yeah, absolutely. I think peer delivered services are really powerful. Um, I know so many people who've been helped by them, and I've worked alongside peer supporters, and I just think they're really integral to mental health services. The first person that we're going to hear from is Matthew McDonald, who is a peer support specialist and a member of your team. So let's listen to what Matthew has to say.
Hello, Michelle, and hello, everyone. My name is Matthew McDonald, and I am a person who is in recovery from a significant disruption of my life due to mental health difficulties. But the short story I will tell today is one of hope. For years, my struggles carried me into many institutions, supportive housing settings, welfare safety nets, and the like. However, one of the influences that changed this trajectory was the introduction of peer support into my life. Peer support services are a nationally recognized and Medicaid billable offering where people who have lived experience of being unwell mentally then go forth to share their experiences of recovery with people who are navigating the same support systems. As a person who was highly resistant to the care and treatment being offered during my lengthy period of being unwell, peer support provided the insight I needed to see that recovery is possible. Peer support did this by naturally showing me examples of people who had changed their path from one of absolute resistance to one of creative engagement. That is, people who were otherwise trying to disentangle themselves from systems of care became more accepting that while these systems are imperfect, they are trying to help. Peer support indirectly reinforced the value of other forms of mental health support. Inspired by the impact that peer support had on my life, I eventually became a peer support specialist myself, and since then I have learned a multitude of other applications of sharing one's own recovery story to help others. Thank you so much for having me, Michelle.
I really loved what, Matthew said about his experience, his own experience, and a powerful example of how peer support services can help people experiencing symptoms or mental health conditions to recover and engage in their lives again. And also how important it is to use one's story to inspire and help others. Amy, is there anything you'd like to add?
I think that Matthew's story and his ability to articulate his experiences and share them to inspire hope in others is powerful. He speaks very genuinely about his resistance to traditional systems of care and his acceptance of peer support, because for him, peer support was a lifeline. And that really speaks to the power, I think, of the personal narrative.
Yeah, I'm so glad you brought up you capture that idea of resistance to treatment, because I think that as a mental health practitioner, sometimes, we can get into that, oh, that person isn't motivated, they aren't engaged. And yet we can learn so much when we hear from peers and we can look at it from the other perspective. So that's another true benefit of peer delivered services. Next up, we're going to listen to a clip from another amazing peer support specialist, Maryam Husamudeen, and she is a user support specialist at the Academy of Support Services. So let's listen to Maryam's clip, thinking about what do peer delivered services look like and what should we know about them.
Hi, I'm just going to talk about some important points about delivering peer services. Compassion for self and others is very key. Having compassion for yourself allows you to understand and feel compassion for the other person that you're working with. Listening skills are very important as well. Being able to hear that person say what they need to say and not try to fix them. Most of the time, people don't want to be fixed. They just really need someone to listen. So that allows you to give them a sense of validation. Know that anyone that survives trauma has coping skills. Ask them, what did they do? Be open to accept the language they chose to express themselves with. That's very helpful. Who can deliver peer services? Truthfully, I believe anyone with those points of views that I mentioned can deliver peer skills, but better with training on techniques, language, words, understanding of things you may not have experienced. So what might that look like? Peer services have many different forms. There's one-to-one, which is just you and another peer in a relationship. Then there's a bridger, someone who connects the peer to services they may need or want to reconnect themselves to the life that they want. There's telehealth, which is phone calls, text, FaceTime, Zoom, to peers to communicate and assist. Groups invite peers to come together and create a community, discuss topics of interest to them, and advocate. Assisting a peer with accessing services or understanding they may want to relay by supporting them is important. Therapeutic arts, of course. I've shared music, poetry, museums, Dave and Buster's, movie trips. I've attended anxiety support groups with peers, opening up ways of communication on their level, the way they can, and open up avenues to explore other ways of communication. Why is it important to keep it simple? They are normally not used to having a voice or feeling like anyone will listen. I reassure them that they are not a bother, no matter how they contact me or when, and they can take their time with me. I attempt to show them worthiness. They are worth my time and attention.
Maryam is an amazing peer. She's listed those skills and strategies that peer supporters need. Things like compassion, listening skills, no fixing, acknowledging coping skills of the person, using respect and compassion in services and in interactions, basically. And she gave us some great examples. She was so concrete in how they might be delivered. For example, one-to-one, as a peer bridger or linking the person to other services, telehealth, groups, advocating, and therapeutic arts. So, Amy, is there anything you'd like to share about the skills and strategies needed to be a peer, or what mental health providers should know about them?
Yeah, so Mariam has really done it all and has given so much to so many people in her peer support roles over, the course of a long career. And she's just such a valuable member of our team and just a great human. And I heard loud and clear from her that peer support workers aren't trying to fix people, because she emphasizes such a critical peer support principle. And that is to accept people for who they are, how they speak, what they want. And people are not a bother. They're worthy of support. I think I would encourage people who are interested in learning more about peer support as an occupation to check out two SAMHSA products. And SAMHSA is the Substance Abuse and Mental Health Services Administration. So the first is the National Model Standards for Peer Support Certification, and that was very recently released this year. And the second is the Core Competencies for Peer Workers in Behavioral Health Services, because those two resources really encapsulate what does the peer support specialist do, and how can we provide training as a pathway to certification for people who seek out peer support as an occupation. I've also been working very closely with a group of colleagues on kind of an extension of that, which is peer support supervision research, because once people receive the training, they become credentialed and they're employed, supervision becomes paramount to support folks in the role. So we've been looking at a 5-function model of supervision that was developed by Dr. Jonathan Edwards. And That study has been concluded and our manuscript is under review. And I'll be really excited and happy to share that reference with you and your audience, Michelle, when it's available.
Oh, well, exciting. Well, congratulations on that work. And I think you're bringing up a really great point that when we learn new skills in our field, we do need the supervision to support us. And it's so exciting to hear that your team and you are researching and considering how to take it to the next step. And I think that really segues nicely into our last audio clip where we're going to hear from Rita Cronise, the coordinator for the Academy of Peer Services Virtual Learning Community and the Peer Support Services Technical Assistance Center, also known as PeerTAC. So let's listen to what Rita has to say about some models of peer support.
Peer support is human connection. It is about connecting with someone who is like you, someone who is having or has had the same or very similar experiences. It is about no longer feeling like you're the only one who has gone through this challenge. It is about the hope that the worst of the challenge won't last forever, and it is about giving back when it's your turn to support somebody else in need. At its most basic level, peer support is about a natural human response to help people who are like us. And this can happen between mothers who have children with the same diagnosis, between combat veterans who have fought on the same battlefield, between caregivers who are taking care of parents with dementia, between first responders who have experienced the same conditions, and between doctors and members of other healthcare professions. Peer support happens when people in a similar situation can share a common experience and know they're not alone in the challenges that go with that experience. When we talk about peer support in mental health and substance use settings, there are different layers of peer support, and there's a difference between peer support as a human response and peer support as a service. At the level of a basic human response, people have been helping each other through mental health and addiction conditions since the beginning of history, and peer-led self-help groups have existed for decades. I was 40 years old when I walked through the doors of my first community-based self-help group in 1999, and it ended cycles of psychiatric hospitalizations I had endured since my teens. It was where I found that I was not alone, and I was accepted because of what I was experiencing, not in spite of what I was experiencing. I went from attending to facilitating to training facilitators of support groups, and eventually to becoming a certified peer specialist, a peer specialist trainer, and a developer of training for peer specialists. The ability to work with and train peer specialists has been an amazing and rewarding experience, and one that the professionals gave no hope of achieving when I entered the mental health system in the 1980s. When we talk about peer support services, as opposed to the natural and freely given human connection, we are talking about a paid service that takes advantage of this natural human response in people who have had lived experiences that are the same or similar to the people who are receiving the service. Like the natural response, it is about creating connection, treating people as equals, building trust, offering choices and options, and sharing one's life journey with a sense of hope that things can and often do get better. At the same time, peer support services come with system requirements, like creating documentation, limits on the amount of time someone can receive services, supervision by people who are not peer specialists themselves and may not fully understand what is needed to provide good peer support, and restrictions on what can happen in the peer support relationship after a person is discharged from services. But in spite of some of the limitations, paid peer support services have been able to reach many more people who have greater needs for human connection and empathy than those who find their way to attend self-help support groups in the community. And for that reason alone, peer support services, in spite of the limitations, are helping people in some of the most disadvantaged parts of our communities to find hope and help in the face of life challenges.
Rita really makes the point, I think, that all peers need to focus on the human connection and reminding people that they're not alone. And she has this quote that I just really love, and I'm going to hold it near to my heart these days. Hope and health in the space of life challenges. And it's sort of feels like a dichotomy, but I think that that's really the essence of peer support is like you can be healthy and well despite or, with whatever is going on in your life. And she also talks a lot about when peers are paid, that can look a little bit different than unpaid peer support because paid peer support may include time limits or restrictions on relationships and supervision by non-peers, which, as you were just mentioning, is not ideal.
Mhm.
And Amy, I'm curious, can you highlight any research outcomes and evidence for peer support or anything else you'd like to add?
Yeah, I'd love to. I think it's important that Rita mentioned in her clip that, it wasn't until she was 40 years old that she was able to even access peer support, so that experience was not available to her in the 1980s when she first started receiving mental health treatment. But thankfully, um, the proliferation of peer support has grown. And so what we know from the research and the evidence is that peer support services are cost effective and cost saving. And I mentioned that kind of upfront because for systems of care and for funders and for legislators, we need to be able to demonstrate return on investment. Not that I feel is the most important outcome, but it is an evidence, a bit of evidence that can help to influence the implementation of peer support across settings. So it's cost effective and cost saving.
That
Go ahead.
No, I would say that's I think speaks to a lot of the administrators, but I know there are other benefits too, and I interrupted you.
Oh, that's okay. That's all right. So the I think two other outcomes associated with peer support are important to look at because they are frequently measured across lots of interventions, and that is average days spent in the hospital and types of hospitalization. So we know that people who receive peer support services have a reduced average inpatient stay when they have access to peer support, so less days in the hospital. And we also know that there's a reduction of involuntary hospitalizations for people who are receiving peer support, especially like crisis and respite peer support. And that's important to note because involuntary hospitalizations oftentimes lead to more traumatization and more negative outcomes. And so if a person is supported in using the hospital for a shorter period of time, their longer term outcomes are typically better. We also know, kind of as an extension of those two data points, that peer support increases the length of time that individuals spend in the community before their first psychiatric hospitalization. So that means that people are well for longer periods. And if they do have to use the psychiatric hospital, their outcomes are typically better because they're there for less time and they have peer support as they transition out. We also have access to several studies that compare peer staff and non-peer staff in how they provide any kind of mental health services. So that there's studies that look at what are the differences among the two types of staff. And what we see in that literature is that peer delivered services in many ways improve outcomes around engaging and connecting with people, especially those who have been identified in some way as difficult to reach. We also can see that there are, again, reduced rates of hospitalization and days spent in inpatient settings. And in some of those studies, there's also been a reported decrease in substance use among people with co-occurring disorders when they have peer support. Another interesting finding is that when people have peer support mentors or coaches, they do better than control groups with no peer support around not only hospitalization, but also symptoms of depression, and anxiety. So that's another pretty solid outcome. And then finally, people who are receiving peer services report that they communicate better with their providers. They feel more empowered, more validated, compared to people who are not receiving peer support. And so there is this real body of evidence that suggests there are positive outcomes associated with peer support services, and that there is also greater perception among people receiving peer support around their sense of hope about recovery, which really is that's the money factor.
Well, right. For individuals, that's like way more important than,
Absolutely.
anything else. And I love, sort of what you've talked about. I'm just going to sort of summarize a little bit, is it seems like, there's a lot of evidence at a systemic level, at an organizational financial systems level, but also real powerful evidence at the individual level for engagement, connection, quality of life, hope, and recovery. And I know I was involved in a peer bridging, justice involved peer bridging or project at some of the psychiatric hospitals in New Jersey. And it was pretty amazing, those connections for people. So thank you for sharing that. And at this point, I think I want to know, how can we learn more? I mean, we've talked about so much. How can listeners learn more about peer services?
Yeah, so I'd be happy to share a couple of resources. I also just wanted to highlight a couple of like future directions that are, happening nationally for peer support that kind of tie into the resources I'll share. I think that the future of peer support is really bright, and it's going to take consistent advocacy to ensure that peer support values are upheld and that the workforce is viewed by interdisciplinary teams as a valued resource. That's critical. I recently attended a 2-day SAMHSA hosted National Peer Workforce Summit virtually, and was really inspired by the speakers and the panelists, because they addressed these 3 critical issues affecting peer support and its continued and expanded implementation. And those 3 issues were financing, authenticity, and peer to career, which speaks to workforce development. And I really think it was brilliant to frame all of the discussions around those 3 topics, because they affect every aspect of peer support, implementation, and workforce. So there were a lot of other important subtopics as well. But generally speaking, I think the continued and expanded financing for peer support so that it's a billable service, and maintaining authentic peer values within those services will support people in ensuring that there are career pathways for peer support workers. These are important issues that I think we have to continue to discuss and promote. And my focus for the past 12 years with the Academy team has been on training and preparation for peer specialist certification. So one area of continued development that I'm committed to is quality training, training that is relevant to peer support roles and in alignment with the peer support principles and guidelines. So that requires a commitment to quality and fidelity to peer support. I think a second part to that is specialty training for credentialed peer support specialists in the areas of justice involvement, which is one you just described, crisis, health and wellness, peer supervision, and older adults. So the second part I think I'm really curious about in peer service implementation is, how is that done well in more traditional settings like clinics and outpatient programs, so that there's not this reliance on clinical goals, but more so the intention of promoting true peer values and outcomes. And then finally, I think myself and many others are very passionate about supervision, as I noted before, and would like to see the CMS guidance include peers supervising peers, mandatory training for peer support supervisors, and other opportunities for continued education. So, as SAMHSA stated, the most important thing about supervision is that it happens. And I believe that But I also believe that unless you have done the job or understand the job, it's really challenging to supervise someone else in that job. So supervision is an area for continued development. So in terms of how can people learn more, I think one of the best places to start is at the Academy of Peer Services. And that's the training, testing, and tracking platform for certified peer specialist training. It's a New York sponsored product out of the Office of Mental Health, but it is an open source curriculum. So that's academyofpeerservices.org. I think you can also visit the Academy of Peer Services virtual learning community, which is chock full of resources and opportunities to connect around peer support services. And that's aps-community.org. And then our third product is the Peer Support Services Technical Assistance Center, which is a collaborative effort between Rutgers University Department of Psychiatric Rehabilitation and New York University's McSilver Institute. So that is at peertac.org. And then finally, one of the resources I mentioned earlier in the podcast is SAMHSA's National Model Standards for Peer Support Certification. So if you visit samhsa.gov and put the National Model Standards in the search bar, you can check those out right at the SAMHSA website.
Wow. Well, Amy, you've given us a lot of food for thought in terms of the future of peer support getting so much more specialized. And I know I highly recommend our listeners to check out your website. I'm a participant in the learning community, and I've been so fortunate to work with some of your colleagues and some other peer support specialists on developing some of the content for the older adult section. And I think that it's really important that we do educate ourselves a little bit more, because peers are really, really important and an integral part of the mental health system, really.
I couldn't agree more, Michelle. I thank you not only for having myself and my teammates on your podcast, but also for all of the contributions that you've made over the years to the Academy, bringing your expertise and your knowledge, and just generally for supporting our efforts for so long. We couldn't be more appreciative.
Well, thank you, Amy. I'm grateful to you and your team for so much of the hard work that you've done. So I think we have to end here, but thank you, Amy. It has been really exciting to get this done and to learn more about peer-provided services and peer support specialists and what they offer. So thank you very much for your time.
Thanks, Michelle.
And thank you to your team as well. This podcast is a production of the Northeast and Caribbean Mental Health Technology Center at Rutgers University and made possible by funding from the Substance Abuse and Mental Health Services Administration.